morning, viewer. Bendasia. Here's the most amazing news. Yeah, how effective medication are depends on various factors, including the time of day when they are administered. Why? Because our bodies don't always function exactly the same. Instead, they follow the cycle set by their internal clock, otherwise known as circadian rhythm. But since each person's circadian rhythm is different and depends on a number of different factors, it is difficult to tailor medication schedules to an individual patient's body clock. Researchers at Charity University in Berlin have now developed a method for determining the optimum time of cancer treatment based on certain breast cancer cell lines. They describe their approach in the journal Nature Communications. A person's internal clock sets the rhythm of many different bodily functions and metabolic processes such as sleep and digestion. But the organs are not the only things that are more or less active depending on the time of day. Individual cells also follow a cycle set by a person's body clock, so they respond differently to external influences at different times of the day. This is hugely important to chemotherapy administered to treat cancer. Previous studies have shown that chemotherapy is most effective when the tumor cells are dividing, but these findings has been hardly used at all in clinical treatment today. An interdisciplinary team at Charity headed by Dr. Ardian Enrico Garanda from the Charity Comprehensive Cancer Center set out to close the gap. The team began looking for the optimum time to administer medications based on the individual circadian rhythms of the tumor. We cultured cells from patients with triple negative breast cancers to observe how they respond at different times of a day to the medication administered, explains Caroline Actore, research associated in Garanda's working group. Triple negative breast cancer is a highly aggressive form of breast cancer with few effective treatments available. We used live imaging, a method of continuously monitoring living cells, and complex data analysis techniques to monitor and evaluate the circadian rhythms, growth cycles, and medications responses of these cancer cells in detail. In this way, the researchers identified certain times of the day at which cancer cells are most responsive to medication based treatments. For example, the chemotherapeutic drug 5-fluorouracil, that is called 5-FU, turned out to have peak efficacy against a certain cancer cell line between 8 and 10 am. As the study also shows, the crucial aspects here are certain cellular and genetic factors. The scientists were even able to identify which genes are key to the circadian effects of certain medications. Beautiful. Bow down, sir. Be in this exclusive report.